Nicotine is another drug that can be directly tied to your physical wellness. In this video, we'll show you some information about nicotine that you may not know. For example, did you know smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer? Estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing lung cancer by 25 times, and of women developing lung cancer by 25.7 times. Smoking causes diminished overall health, increased absenteeism from work, and increased health care utilization and cost. Secondhand smoke is the combination of smoke from the burning end of a cigarette and the smoke breathed out by smokers. Secondhand smoke contains more than 7,000 chemicals. Hundreds are toxic and about 70 can cause cancer. Since the 1964 Surgeon General's report, 2.5 million adults who were non-smokers died because they breathed secondhand smoke. There is no risk level of exposure to secondhand smoke. Secondhand smoke causes numerous health problems in infants and children, including more frequent and severe asthma attacks, respiratory infections, ear infections, and sudden infant death syndrome, also known as SIDS. In spring 2022, the American College Health Association, ACHA, surveyed more than 54,000 undergraduates about drug use. Cannabis, 41.9%, tobacco and nicotine delivery products, 33.1%, hallucinogens, 8.9%, and prescription stimulants, 6.9%, were the most used drugs by college students other than alcohol, which was the most used substance. A study from the fall of 2022 found that the most used tobacco products among college students in the United States were e-cigarettes or other vape products. At that time, around 78% of college students who used tobacco products in the past 3 months reported that they used e-cigarettes or other vape products. The same survey found that among college students who reported ever using tobacco products, around 24% stated they used tobacco daily or almost daily in the past 3 months, while 24% had used just once or twice. Although e-cigarettes are the most used tobacco products among college students, the most commonly used form of tobacco among U.S. adults is still regular combustible cigarettes. In 2020, around 11% of women and 14% of men were current cigarette smokers, compared to about 3% of women and 5% of men who smoked e-cigarettes. However, e-cigarettes is much more common among younger adults, not just college students. In 2020, around 9% of those aged 18 to 24 used e-cigarettes, while 7% smoked combustible cigarettes. Smoking in the United States has dramatically decreased over the past few decades. In 1965, it was estimated that around 42% of adults in the U.S. smoked, but this number was only about 14% in 2019. Nevertheless, that is still almost 31 million people who smoke and are at risk of premature death due to cancer, cardiovascular disease, or stroke, just a few more risk factors of smoking. The state with the highest percent of adults who smoke is West Virginia, while Utah has the lowest prevalence of smoking. In 2021, around 20% of adults in West Virginia smoked, compared to 6% in Utah. What are e-cigarettes? E-cigarettes are electronic devices that heat a liquid and produce an aerosol or mix of particles in the air. E-cigarettes come in many shapes and sizes. Most have a battery, a heating element, and a place to hold the liquid. Some e-cigarettes look like regular cigarettes, cigars, or pipes. Some look like USB flash drives, pens, and other everyday items. Larger devices, such as a tank system or mods, do not look like other tobacco products. E-cigarettes are known by many different names. They're also sometimes called e-cigs, e-hookahs, mods, vape pens, vapes, tank systems, and electronic nicotine delivery systems, also known as ENDS. Using e-cigarettes is sometimes called vaping. How do e-cigarettes work? E-cigarettes produce an aerosol by heating a liquid that usually contains nicotine, flavoring, and other chemicals that help make the aerosol. The liquid used in e-cigarettes often contains nicotine and flavorings. This liquid is also called e-juice, e-liquid, vape juice, or vape liquid. Users inhale e-cigarette aerosols into their lungs. Bystanders can also breathe the aerosol when their user exhales into the air. E-cigarette devices can be used to deliver marijuana and other drugs. E-cigarette aerosols are not harmless water vapor. The e-cigarette aerosols that users breathe from the device and exhale can contain harmful and potentially harmful substances, including nicotine, ultra-fine particles that can be inhaled deep into the lungs, flavorings such as diacetyl and a chemical leak to serious lung disease, volatile organic compounds, cancer-causing chemicals, heavy metals such as nickel, tin, and lead. The aerosol that users inhale and exhale from e-cigarettes can expose both themselves and bystanders to harmful substances. It's difficult for consumers to know what e-cigarette products contain. For example, some e-cigarettes marketed as containing 0% nicotine have been found to contain nicotine. Why is nicotine unsafe for young adults? Most e-cigarettes contain nicotine, the addictive drug in regular cigarettes, cigars, and other tobacco products. A CDC study found that 99% of the e-cigarettes sold in assessed venues in the United States contain nicotine. Some vape product labels do not disclose that they contain nicotine, and some vape liquids marketed as containing 0% nicotine have been found to contain nicotine. How does nicotine affect mental health? When a person is dependent or addicted to nicotine and stops using it, their body and brain have to get used to not having nicotine. This can result in temporary symptoms of nicotine withdrawal. Nicotine withdrawal symptoms include irritability, restlessness, feeling anxious or depressed, trouble sleeping, trouble concentrating, and craving nicotine. People may keep using tobacco products to help relieve these symptoms. Youth may turn to vaping to try to deal with some stress or anxiety, creating a cycle of nicotine dependence. But nicotine addiction can be a source of stress. Youth e-cigarette and cigarette use can have been associated with mental health symptoms such as depression.